Atlanta is a special city. I've lived in many cities during my lifetime, many great cities, and have much to offer. But what makes this city different is the broad commitment of its citizens, its corporations, its institutions to bettering the lives of its citizens.
This is the home of the civil rights movement that clearly showed the world what it takes to pull diverse segments of a society together to further a goal. The Olympics that Atlanta held here, again, I think a shining example of how a city comes together around an important goal.
Everyone here feels that they have ownership in the city and are working to make it better, to address problems. All of these come together really in a unique way to make this an increasing center for global health.
Atlanta is full of international organizations such as the Carter Center and CARE and CDC.
But also, Atlanta is the home of more than 50 colleges and universities, many of which are very actively involved in public health and global health. Emory University, Morehouse College of Medicine, Georgia State University, Georgia Tech, University of Georgia, are all involved in global health work.
Beyond that, we have to talk about the Coca-Cola Company. It is, of course, a legendary, iconic brand, but it has been involved very seriously in the field of public health for a long time.
Coca-Cola and Atlanta have always had a long-term partnership. We care deeply about the communities in which we operate and the communities that we serve. And Atlanta is a special place for us.
So I think what's, again, important about Atlanta is that we've demonstrated the value of partnerships. When you combine the expertise of these different institutions and have them working together, I think that's unique. That it's not just one university or one NGO working, but it's this partnership that's allowed us to make a significant contribution.
But Atlanta, again, has remarkable institutional strength. And it's not just the city of Atlanta, but throughout Georgia, there's strength.
In Georgia, we are truly a crossroads for much of the United States. We have the world's largest and busiest airport, which means we have a lot of people from a lot of different locations all around the globe who pass through our area. So we are a state, I think, that have to be concerned about global health.
So from an academic point of view, from a transportation point of view, and from a corporate point of view, we're really very involved every day in the health issues, not just in our region, but indeed around the globe.
U.S. government has been one of the most important country in terms of providing resources and helping to really create hope to millions of people.
Take immunizations for one. The U.S. has been part of a global coalition that's increased infant vaccinations and saves 3 million lives every year and has more to save.
I think an area where the U.S. has provided a lot of leadership and has really made a big impact has been HIV/AIDS.
Well, if you look at the past decade, you can't look past any further than President Bush's PEPFAR initiative, the President's initiative to eradicate AIDS. A terrific program that's brought about great results.
Not only in the treatment of HIV/AIDS, but the coming to understanding transmission and how to provide interventions to really reduce levels of infection rates.
Because of PEPFAR, there are 4 million people today alive, walking around, learning, teaching, working, growing up healthy. And last year alone, 200,000 babies were born without HIV who would have had HIV if it weren't for PEPFAR.
The spotlight always goes to HIV/AIDS with the PEPFAR program, but there have been tremendous advances also in malaria, in tuberculosis, and in other areas such as child survival.
We've brought down death rates from certain diseases. Some diseases are on their way to being eliminated. River blindness, elephantiasis, blinding trachoma. These are huge advances that benefit millions and millions of people.
Global health is critically important because it's the right thing to do. It's what a great country like the U.S. does. And I wish the American people who wonder what their dollars are doing could come with me when I go to other countries and I see the enormous difference that we're making in people's lives.
The declaration was developed by 3 partners, the World Affairs Council of Atlanta, CARE, and CSIS. but in collaboration with other key stakeholders in the Atlanta communities.
We have put this declaration together in order to register the special assets that Atlanta brings to the whole question of U.S. leadership in global health, and to lay out a very succinct vision of what the next Congress and next administration should really be focused upon as the top line priorities in carrying forward U.S. leadership in global health, including in the water sector. And those break down into really 4 key points.
You have Southern governments showing up and playing a major role, making major commitments that are already producing results. And that's very important because in the long run, they're the ones who are going to be providing the resources. They're the ones who are accountable to their citizens.
The emerging powers, China, India, South Africa, Brazil, these are countries which have within their borders large underserved poor populations where the health demands are acute. And that needs to be a bigger dimension of our diplomacy.
It's important that we have the different organizations involved, including the multilateral organizations.
And that is about investing in the Global Fund to fight HIV, TB, and malaria, investing in the Gavi Alliance. That's a way of bringing others in as part of a shared responsibility strategy.
The U.S. has always had a real preeminent role in global health efforts. One aspect, though, that I think has been missing is the integration of our water efforts into that.
The interconnected issues of water, sanitation, and hygiene ought to be a cornerstone of the United States foreign policy on a whole range of areas. Part is just the humanitarian. Half the people who are sick at any given time are sick needlessly from waterborne disease.
Water will continue to be one of the world's most pressing problems over this century. In the developing world, water-related disease claims about 5,000 children every single day. An estimated 320 million productive workdays are lost to illnesses from unsafe drinking water and lack of access to sanitation. Much of that burden is carried by girls and women.
The big challenges in water and sanitation and hygiene is sustainability and scale. And one way to overcome that is by integrating water and sanitation and hygiene with existing health programs.
Dollars are very precious in the United States right now. The more transparency to the benefits that are being derived from the use of American healthcare initiatives overseas, the better off we'll be able to continue to appropriate the funds necessary to make a difference in the lives of citizens around the world.
Bipartisanship or nonpartisanship is extremely important in terms of any issue that's going to last more than 5 to 10 years. We dare not lose it in the field of health because the world depends a lot on American leadership in the health field.
Now we're fortunate in America. We have the largest budget and the largest budget of global health spending thanks to bipartisan support from Republican and Democratic administrations.
I think we are very caring people, we're very generous people, we're very philanthropic people, but it goes beyond any of those things. It gets right down to the question of how do we protect our own citizens, and the way we help protect our own citizens is to recognize that the fight against infectious disease, the fight against the lack of water and impure water around the globe is important right here at home in the state of Georgia.
Atlanta is standing very tall in bringing its gifts to the issue of how to help the world solve its global health and development problems. So I see Atlanta as leading the way.